Vaginitis. Ouch. What's going on, Secoya Nation? Dr. Shelley bringing you today's wellness wisdom, and we're talking about an issue that faces women on a regular basis, some more than others. Had a young lady, Adrian, reach out to us recently saying, second time in 5 months, what do I do? And the first knee-jerk reaction is like, people want an antibiotic, they want to do some type of medication for it, but we're here to give you some different information about how you can get to the deeper level and understand it, rather than just thinking you want to medicate it or something like that. So, for any of the men listening who don't know what the vaginal mucosa is, the irritation in the flora, in the bacteria in the vaginal canal, there's a really strong relationship between the gut flora and the vaginal flora. So if you have an imbalance in the flora in your mouth or in your vaginal canal or things like that, you have to look to the gut as well. So just a word to the wise, you're probably having some type of digestive issue as well. Oftentimes that's related to not being able to accept some type of situation. So that's going to play part and parcel to what we're talking about today as far as the bacterial vaginitis or the vaginitis in general. When we think about the vaginal mucosa, which is the tissue where the bacteria live, and they're a normal part of your body, they help build up your body. So if you're having symptoms of bacterial vaginitis or something like that, it's because your body's trying to heal something, trying to repair something, it's trying to repair a conflict of some sort. And so when there is a relationship, typically with a mate, where you feel unable to nurture either yourself through the relationship or them, you're feeling separated from that partner, that spouse. It could be related to divorce, separation, in rare cases or unexpected deaths and things like that. It could be loss of a mate, or it could be a breakup, things like that. So these are things that affect the vaginal mucosa in general. Building on top of that, there are other threads in the body of research related to German medicine that relate to bacterial vaginitis specifically. What I just gave you was about the vaginal mucosa specifically. Now we're talking about the vaginitis, if you will. Thinking about when we have a relationship or relationships, in this case, where we sometimes feel unsatisfied in our relationships and we only have intercourse, we only have sex or sexual relations with our partner because we can't find a loving romantic partner. It's almost like Eddie Vedder's, can't find a better man kind of scenario. Or in the case of same-sex relationships, it could be the same, a same-sex partner. So that's something related to not finding a romantic partner that's loving and nurturing, going back to the vaginal mucosa, unable to get over the frustration related to that, and things of that nature. This is really important to understand because if you have these symptoms, vaginal mucosa, external genitalia is about loss of love and loss of that partnership and loss of that connection. So sometimes people have an unsatisfied relationship with someone that they end up trying to find that need to be met in other relationships. Could be multiple of them. So one of the threads related to the vaginitis issue is maybe you're not having intercourse with some other people or multiple people, but it could be multiple relationships. That could be romantic relationships, could be emotional relationships. It just depends. So when there's one or more of those relationships, whether that's intercourse or not, that can play into the disruption of the beneficial bacteria in your vaginal canal and things like that. When there's a disconnect between what we expect from our relationship and the disappointment in not getting what we need in that relationship, that's also related to vaginitis. Remember specifically back to the loss of love or loss of mate and disconnect there. And so if you understand that when these stressors affect your mind then plays a part in changing how your brain functions. Your brain is what interprets your body. And so when we have these stresses in life, it then disrupts the flora in our body, it disrupts the tissue in our body. We could probably talk about dryness in a different video, but that's a common issue, so it's commonly misunderstood. But these are just some threads I want you to consider as far as understanding your body or your partner's body. If you happen to have a partner who says, I can't be intimate with you because I have vaginitis, you might take heed of these ideas and say, where is there a disconnect in our relationship? Where do we feel disconnect or lost and things like that? So
someone's asking if there's a direct correlation between vaginitis and increased cortisol in the bloodstream.
Well, cortisol, yes, it's a stress hormone. So I would say there's most likely, without having any actual evidence to show you, if there is a stress in the body, it's going to elevate your cortisol. And as a result, you're going to see it on the saliva test or something like that. So I would argue that, yes, there's probably a very strong correlation between vaginitis and increased cortisol. So great insight. That's what I got for you today. If you like this, tune in tomorrow. I'll bring in, let's see, tomorrow I'm going to do dyslexia. We had a reading room, is that what it's called? The reading room? an organization moving across the hall, across the foyer in this building, and it's for dyslexia. So I was inspired by that, and I wanted to know more about it, so I did some research, and I'll bring that to you tomorrow. All right? So tune in if you want to learn about dyslexia, and we'll talk to you then. All right? Have a great night, guys.
Wait, someone asked what time are you going to do?
Typically around 5:15 is our goal. Sometimes participants run late, or well, if I run late, or we get entangled in things like team meetings after work. So that's our best effort is between 5 and 5:15, and so
So 5:30.
5:30. Great. All right. Have a good night, guys.